Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society. And today we're going to be talking about a difficult topic, which is really looking at underserved populations and addressing menopause care. And for that, I'm joined by two experts, Dr. Nancy Phillips, Dr. Gloria Bachman, both of them from Rutgers Robert Wood Johnson Medical School in New Brunswick, New Jersey. Dr. Phillips is a board-certified obstetrician gynecologist, an associate professor and director of the Center for Vulvovaginal Health in the Department of Obstetrics and Gynecology. And Dr. Gloria Bachman, as well, is an obstetrician gynecologist, a full professor, and associate dean for women's health, co-director of the Women's Health Institute at the same university, and also the medical director of the Proud Gender Center of New Jersey and the New Jersey Commission on Women's Reentry. So thank you so much for joining me today. I want us to focus on, if I'm a woman who is coming from an underserved community, and you can define what community I might be coming from, and not sure how to bring up a topic of menopause. What is it that I can get some help with in terms of putting a voice to my concerns?
Let me begin by saying that the best thing to do when you have a visit with a clinician is to prepare for it. That no one, even me, when I see my primary care doctor, I make sure that I have a list of questions, that I have gotten some patient education information so that I understand, what are some of the questions I should be asking, especially as I go through the menopause transition, because it's a major time in a woman's life where she goes from having periods every single month to not having periods, and some of the changes that occur in her body and some of the symptoms that she may be experiencing. So when I say have a list, put it down and make sure that you go through each one. And I want to bring up one other point, and that is, if your clinician does not have time to go through your entire list, then make a follow-up appointment, because many times the clinician's office books patients only a 15-minute slot or a 30-minute slot. And so you may need that time for everything else, but make sure that you make a follow-up visit so that your entire list is being looked at and being addressed, all the questions that you have.
And I think that's so important because my list may be incomplete. I may not know how much is related to menopause or how much I assume is just I'm getting older, and what is aging, and is this a silly question that I'm asking? Am I embarrassed to ask this question? So that's, I think, a universal concern, perhaps.
I think so. And I think that's where the responsibility lies with the physician and the healthcare clinician to make people comfortable to ask questions. I think when people say, is this normal? Your answer can be normal is not defined. Normal is individual. Is this a stupid question? I think it's important to say there's no stupid questions except the ones that you don't ask, because if you don't ask me, you're going to go home and worry about it. So it's better to ask me, get an answer, and then you know what it is. We have to be comfortable giving patients time for open-ended discussion and make them comfortable.
So if I'm in my 40s now and I'm coming to see you and I'm already getting hot flashes, which I think is not the way it's supposed to be. I thought you're supposed to lose all your periods and be much older when you got hot flashes. Why is that?
Well, that is because menopause, it's not really a single moment in time. Menopause is a process, and it can start at 45. It can start younger. It can go on for 3 years. It can go on for 5 years. There's a perimenopause time. I think explaining to women some of the very basic physiology, know how ovaries work, know that there are eggs, know that they make estrogen, know that these levels change with time, and that it's a very complex interaction. And as you get older, it doesn't work quite in a perfect cycle like it may have earlier in your life. But hot flashes can happen while you're still getting periods. They can be troublesome while you're still getting periods. There are things we can do, even if you're still getting periods, or if you're having a regular bleeding or other symptoms. We don't have to wait for the periods to be gone for 1 year before we start addressing the symptoms that you may be feeling from this transition part of your life.
So here's another common question I think that I'm going to approach as a woman. So I've been in menopause for a while and I've had a lot of vaginal dryness. So I think that is either I'm getting old or I don't have the estrogen, but you're not supposed to have estrogen. So isn't that a good sign?
And obviously, we as women always try to normalize situations. But whenever we have any symptom, and with menopause, many of us have many symptoms, every woman should feel comfortable in saying, I need help. And I think those are the 3 words, I need help, because I myself as a patient have had difficulty in saying that if you have vaginal dryness, if you feel irritated, if you have a discharge, if sex is uncomfortable for you, that's not something that you have to suffer in silence. That it's something that you should say, I need help. And what is the best way to care or manage this particular symptom that I'm having? And it not only goes from the vaginal discomfort, but anything that you may be experiencing. As a patient, you may also have feelings of depression, that you just don't feel yourself, or you're not sleeping. You're just up half the night and you're hot and you're cold and you have night sweats. You just feel like you're gaining weight, and there's no stopping to it. That every day you step on the scale and you're not doing anything differently and you're gaining weight. Well, as a patient, as a woman, you have to say, these are symptoms, these are signs that I need help. And again, going back to the list, before your visit with your clinician, make sure you have a list so you don't forget anything, because all of these symptoms, there are ways that they can be managed, and they can be managed with giving you the assistance that you need. So it's so important not to feel that, gee, this is just unique to me, but no, it's unique to, it's common to many women. It's not a unique symptom.
So I think that's so important that you're telling women that it's not up to you to make the diagnosis. It's up to you to talk about the symptoms, because here's another symptom, bladder problems. So how is that related to menopause? Why should I put that on my list? I'm having bladder problems. Either I can't get to the bathroom in time, or I'm up a million times. Like, why should I put that on my list? How could that be menopause?
And that's true, that people, women in general just assume, well, I hear every day, well, I'm just leaking a little bit of urine, I can't make it to the bathroom, but that's normal. That just comes with aging.
Right.
And I think sometimes the media makes it normal. Here's your poise, here's your Depends, here's all your protection, because as you get older, you're just going to leak. And that doesn't mean that it's not common. It is common, but that doesn't mean there's nothing to do with it. How does it relate to menopause? Well, estrogen and the hormone receptors are present throughout the bladder. They're present throughout the urethra. If you have healthy vaginal tissue, then you're going to have better protection. You're not going to get those microabrasions or little cuts during sex that can introduce bacteria, help decrease your risk of urinary tract infections. There's a lot of things we can do to help with bladder symptoms that are not necessarily medication or surgical.
And I do want to bring up that other point that Dr. Phillips brought up, and that is that don't blame it on aging. That so many of us as women blame it on aging. Well, I wet my pants because I'm now 50, or I never, feel comfortable in the vaginal area, or I don't desire any sexual exchange anymore because I'm over the hill. And I hear that so many women, my friends, I hear this, that, well, gosh, this is part of aging, isn't it? And I go, well, don't take that. Check with your clinician, because there are many, many ways to ameliorate, to manage, to take away the symptoms, such as the bladder issues that you were discussing, or the vaginal dryness, or even the sexual issues.
And yes, they might be related to aging. They might be related to menopause. They might be that normal that everybody's looking for, but normal isn't necessarily good. And that doesn't necessarily mean we can't do something about it. And so
No.
don't just assume it's how it has to be.
I think that that's such an important phrase that you've just said, Nancy, that one of the things that women coming into the door to see you have to feel, this is a safe place. This is a place where I can talk about things that I might be embarrassed to talk about elsewhere, or that I'm uncomfortable to talk about, or I don't have anyone else to talk to about this. So, for women who are out there listening, what message do you want to give them in terms of when they're seeing a healthcare provider? How do they get prepared for that visit, and how do they get that comfort level that this is an okay place for me to bring up whatever's on that list?
I think it doesn't always happen on the first visit. I think that you need to maybe switch healthcare providers if you feel like you're not getting your issues addressed, if you feel like you're being brushed off, if you're not comfortable. I think that you should go in and say, these are the 3 questions, or these are the 2 questions I'm going to ask. And if you don't get an answer other than, oh, that's normal, or no, just, use a lubricant, I'll see you next year, then you know that this may not be the place for you to get your health care. And you may not have a lot of options, but certainly you can do a little bit of research on your own, or go in with specific questions. If you're not getting the right answers, then try another healthcare provider.
And I want to bring up 2 other issues. The first is, please insist on getting an interpreter if you do not feel comfortable with the language your clinician is speaking, because many times you have questions as a patient, but you may not be able to express them because English is your second language. So asking for an interpreter is very important. And the other is, when we talk about the one-on-one, sometimes it's 2-on-1, that a woman may have a partner that wants to be part of that interaction, and make sure that your clinician gives you time alone with just you and the clinician. Because if your partner is abusing you, or you're in a domestic violence situation, your clinician can help you get the resources you need, or address some of the issues that you're having. So you should have one-on-one time. And that includes even children, that many times a woman will come in with children, and as a patient, I don't want my child in the room when I'm getting, an evaluation or hearing all my history. And I think that, again, making sure that you have one-on-one time with your clinician is so key.
So I think that these are really important messages that you're telling women to really try and embrace, and have the confidence to be able to say, here is my list, this is what I need. And to also feel that if it hasn't been addressed in that one visit, to come back again.
Absolutely. Absolutely. Because many times it's not because the clinician is not interested in me, Gloria Bachman, the patient, but it's because the clinician has a set schedule. And so it should not reflect on the woman herself. And I should not feel badly because at 15 minutes or at 20 minutes or at 30 minutes, no more of my questions could be answered, but to please make a follow-up appointment.
Okay, well, thank you for giving us such important things to think about as women, and empowering women to really feel that this is not, this is a right, and it's critical to make sure that you do get your voice heard. Thank you so much for joining us today.
Thank
Thank
you.
you.